Hi, I'm Dr. Julie Steinauer. Today I want to talk to you about a patient success story that we have with our clinic. This patient actually came to us with lots of problems with vertigo, dizziness, an oscillopsia, like kind of seeing movement, even though it's actually things aren't really moving. Now, before I jump into talking about our success with this patient, I want to point you in the direction of how you can contact us. If you're local, you can call us at 618-288-1489. If you're not local, go to our website and you can either click on the questionnaire button. If you do that, it will prompt some interaction between us with emails. If you would like to skip that and you know that maybe you've been following for me for a while and you want to just jump ahead to scheduling a consultation, click on the schedule a consultation button. Now, let's jump in and talk a little bit more about this particular individual because she came to us after having a traumatic brain injury about a year or so prior and experiencing some symptoms of vertigo and again oscillopsia, where things are moving for her when she's looking, even though they're technically stationary and still. But her eyes and her brain is determining that it seems like it's in motion. So what did we do with her? Well, she was actually undergoing some treatment for vestibular problems through like OT, PT, and that was something that she had been doing for a while, but it was getting better, but she was still seeking out something to kind of, what's the thing that's really going to fix this all? And so we started her in our syntonics and vision therapy program. Now, technically, we didn't even start the vision therapy aspect of things because our clinic is so busy right now that we have a waiting list to get into it. And so, we're very, very blessed in that we have a waiting list right now for a lot of our patients to get into the clinic. Because so many patients have found us from all over the place. So here's what we did. We started her with syntonics. And so we started her with syntonics for a period of time. And she started on a protocol of 2 filters that are designed to actually kind of heal the brain post-traumatic brain injury. So it's meant to calm down the neurological system. It's meant to cause the brain to kind of have better blood flow, increase like nerve conduction or nerve signals being sent all throughout the brain. And it's just meant to stabilize and calm after someone has had a traumatic incident. And so we started her on that protocol. She noticed within about a month and a half that most of her symptoms were completely gone, and she was able to get back to things like driving and doing regular life stuff. And then there was something that kind of cropped up, something that she did, went a little bit too far on a vacation, happened to be kind of up in the mountains and doing one of these things where, you're up at high altitudes, you're down at lower altitudes, and it kind of messed the system up again. So we continued with syntonics. She ended up, she was done at this point with OT and PT, and she started going to a chiropractor for regular adjustments of her cervical, neck, and kind of upper area into the head region or skull region, and probably like into mid back and lower back. And so with syntonics, at this point we had started vision therapy with her and getting the care of alignments with her cervical spine. She is now doing fantastic. So we had a hiccup. It's much better. Now she's doing fantastic again, and we're continuing to work with her on just improving the two-eyed ability of her, kind of like her two-eyed or binocular vision system, where the brain is able to use the 2 eyes better together as a team. And so she's not experiencing that the sensation of movement or things moving around, nor is she getting that kind of like vertigo, feeling where you feel dizzy and disoriented. So if this sounds like you, or if it sounds like someone that you know and you want to pass the video on, please do that. If you want to contact us in your local, call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com, and you can do one of 2 things. You can either fill out a questionnaire or you can schedule a consultation direct with me to talk about how we might be able to help you. Now, if you like the video, pass it on, hit like. If you haven't done so already, hit that subscribe button, and make sure that you click all on that little bell icon so that you get all notifications of our videos, because we put out some awesome stuff and you don't want to miss out. Thank you.